That's 116 new cases since our update yesterday. I'm saddened to say that there have been 430 Victorians who've lost their life to this global pandemic. That is an increase of 15 since yesterday's report. Of course, our thoughts and prayers and best wishes are with each of those families. This will be an incredibly difficult time for them, and we send our sympathies and condolences to them. That group of 15 is made up of 3 females and 5 males in their 80s, 4 females and 2 males in their 90s, and 1 female in her 100s. All 15 of these fatalities are linked to aged care outbreaks. There are 629 Victorians in hospital. 31 of those are receiving intensive care, and 17 of those 31 are on a ventilator. A total of 2,106,139 test results have been received, which is an increase of 14,811 since yesterday. There are 4,028 cases with an unknown source. That's an increase of 108 since we last updated you, so 108 cases that have been closed out following the coronavirus detective work. There are 476 healthcare workers who are active cases, so those numbers, whilst every one of those is very significant, and this is an opportunity to again thank our health heroes for the amazing job. Their care and courage and compassion is something that we all value, and we are very proud of them and very grateful to them. But those numbers have first stabilised and now they are steadily falling, but that is of great concern to us, and each of us in playing our part, following the rules, doing as we should, making the best choices. We can not only protect ourselves, but we can protect those health heroes. Let's not any of us do anything that might make their job harder and more dangerous than it already is. There are 3,731 active cases across Victoria. I just want to give you a very quick update in relation to aged care and disability. So disability facility settings, first of all, as at the 23rd of August, total active cases 57. 44 of those are staff cases, and there's a total number of 52 sites that are connected to those now active cases. In aged care, since January 1, there have been 3,743 cases of coronavirus, of which 1,568 are currently active. Metro regional split. We have some 232 active cases in regional Victoria, so that number continues to fall, and that is the direct product of those localised public health teams that we've stood up, the good work of regional Victorians right across regional and country Victoria, and of course people coming forward and getting tested, particularly in Geelong, Bendigo and Ballarat, as we have asked them to do. So we're very, very grateful to all of those regional Victorians who, with even the mildest of symptoms, have come forward and got tested. That applies, of course, to every single Victorian, regardless of your postcode. Come forward, get tested as soon as those symptoms first appear, and then isolate at home until you get your test result. It's a massive contribution that you, on a very, very personal level, can make to our collective fight against this enemy. Just in terms of progress, these are very pleasing numbers. 88 cases in Greater Geelong, 24 cases in Bendigo, and I have no active cases in the Ballarat region as of today's sit rep. So that is a much improved position than where we were 10 days, 14 days ago when it came to those big regional cities. That shouldn't promote in any sense the notion that this is done, that you could be complacent in any community, but that's certainly the trend that we wanted to see. Now, just before I go to some legislative changes that we'll put before the Parliament, subject to some work that a cross-party group are doing. I think they're meeting tomorrow about perhaps a hybrid model of sitting, whether it be some in attendance, some online. I'll leave that to the presiding officers and that multi-party group that are coming together. I think the meeting is tomorrow.